Hi, I'm Dr. Michael Epitropoulos, and welcome to our clinic here at the Vera Endo Wellness Institute. I'm a chiropractic physician. I'm also a doctorate of clinical nutrition. My focus and specialty for many years has been in the field of natural medicine. What I want to demonstrate to you folks, though, is what we do when you come in as a patient for chiropractic care. And we are fortunate to have a patient sitting with us today, Kim, and we're going to show you just exactly what you can expect as a patient coming in for care. Chiropractic is a science, a clinical science, whereas a physician as myself studies the spine, determines where there is what's called a subluxation, which is a misalignment of a specific vertebra of the spine, a bone of the spine, and if it's gone out of misalignment, it's gone out of alignment, how it's moved, we determine and detect it, and then we correct it through a very general process. And I'm going to show you how I go about doing that in just a moment. But what I wanted to show you folks is, again, what do we do in our preliminary examination for the chiropractic care that you're going to be receiving from us. And with that, I just want to show a little bit in having Kim sitting as she is. Basically, we would be looking at your spines, how you're sitting. We would be examining the neck, and we would be feeling along the neck. I would be feeling along the lower part of the neck and the upper back, and basically looking for tension, tightness in the muscles, because a big part of what I do as a chiropractic physician with my patients is not just realigning these subluxations, these levels of misalignment, but also working on the muscles that have tightened, which have caused the misalignment to begin with. So I'm examining the spine and the neck and the middle back as well as the lower back, feeling along the regions so that I can identify those tight muscles. And in just a moment, I will show you what I will do with those tight muscles. In just a moment, we're going to have Kim lay on her back. We're going to show you how we do a bit of an exam, and that would include muscle testing and such. I'm going to have you lay down, please. And Kim is going to lay on her back. And we're going to begin with doing a preliminary orthopedic neurological exam. In order to do this, I'm going to have Kim raise her chin to her chest, if you would, Kim, and do that, and relax your head back down. Very good. Now we're going to go to down here, if you would, and camera following us. Kim, I'm going to have you raise your left leg, keeping your knee straight. And then we're going to raise your right leg, keeping your knee straight. And then we're going to bend your leg just like this. And what we're looking for is Kim to tell us if she has pain. And she's not telling us that she has pain. We're getting a good test result with. And finally, we're going to have her raise both legs together, and we aren't getting or eliciting any pain. Next, I'm going to take Kim's neck, just like this. Relax your neck, Kim. And I'm feeling along, as I would do with each patient, feeling along for areas along her neck, the bones of the neck, the spine, cervical spine as we call it, for sore areas. Right and left, as I mentioned earlier, we're feeling for tight muscles. And I would work on releasing and relaxing those tight muscles in order to give the proper adjustment when we have to. And finally, I will feel this area of the spine on Kim. I will ask her if this is sore. If it's sore, that tells me that that area is where the muscle has been in spasm. It's pulled the vertebra out of alignment. I will then look at her x-rays. I'll do further physical exam and confirm that this is the level that we need to adjust, and then correct it through the adjustment. And finally, in summary, in completing the chiropractic exam, we then will give you a progress exam overview in terms of it, we call a report of findings, that will allow us to tell you exactly what we see as the problem at hand, what we recommend as protocol, the treatment plan, if you will, and we will bill your insurance directly for you. We try to accommodate our patients in every way possible, because our feeling, my philosophy, is we will do everything to help you reach for your highest health potential. Really turn on that body's inner healing ability.